My name is Dr. Maximo. I'm a hand and wrist specialist here in Houston. I've been in practice for about 17 years, including training. I chose the specialty because it was a personal issue for me. I always knew that I wanted to become a surgeon. When I was in training, my brother had a hand injury, so I got exposed to the hand aspect of medicine and orthopedic surgery. Kind of really got attracted to it and wanted to pursue that as a career. I specialize in hand and microvascular surgery, so I do a lot of minimally invasive procedures, especially carpal tunnel. We're able to do it with a very small incision that doesn't require stitches. The surgery takes about 10 minutes. They can use their hands right away. They don't have to stay in the hospital. So having that procedure performed on some of my close friends and relatives, they've done amazing. As a surgeon, I can't do it on my own. I have to have great support staff. So here it starts with the nurses. We have a great therapy department. We have a great radiology department with the radiologists that are very knowledgeable in hand and wrist issues and ailments. And I'm able to talk to them. It's not a huge hospital where I don't feel connected to the system. When I pick up the phone and call a radiologist, I know who I'm calling. When I pick up a phone and call a therapist, I know exactly who I'm talking to. And sometimes that helps because each patient is a unique individual and we're not all the same. So that it allows me to provide the best care that I can get. There's a lot of proactive things that patients and people can do to prevent hand problems and to improve hand issues. So for example, even as simple as just coming to see me when they have a little pain of their hands, fatigue after using a keyboard, or a little numbness and tingling, that can be adjusted with ergonomics, like adjusting a keyboard or a mouth or just their position while they're using the hands. So coming in to see a hand doctor or a hand specialist, it's always good. And sometimes we refer our patients to therapy, and they can educate those patients how to use their environment around them to help them function better, and then obviously not have any issues with their hands. Here at Houston Physicians Hospital, we have a great therapy department that I work with on a regular basis. So we talk and we take each patient individually and kind of go over their case and see what they need and see what can help them. With hand surgery, I get to meet different types of people from different avenues of life. I see patients, new mothers who just had a baby and they're having issues with their hands. I see older patients that have arthritis in their hand from working for years. I see patients that work in plants and factories, and I see executives that work in offices, pilots, athletes. So all of them bring a unique challenge to my practice, but also they bring a lot of different aspects of life. I can talk to them, I can understand what their issues are and support them and help them get through it. What I love most about my patients is that I get to talk to them. I get to hear their personal stories, how they ended up with hand issues. And I'm able to relate to some of them, whether they're doing hobbies or playing sports. I'm able to hopefully treat them and get them back to their normal level of activity so they can enjoy life and not worry about their hands. One thing I want to tell my patients is that they should come and see me earlier on. I always meet people and they tell me they have arthritis in their hands and they're not able to open a jar or able to do something that they enjoy, such as gardening or playing sports, and they think that there's no treatment for it, whereas we have different treatment options. A lot of them don't involve surgery that can get them back to their normal activities without having to worry about their hand issues.